Welcome to the Rojas Report, where we break down the business of healthcare without any sugarcoating. Today, we're going to expose healthcare's money pit, how health systems are still fighting price transparency, the truth behind the Medicaid spending cuts, and why state employees, especially in North Carolina and South Carolina, are about to get wrecked by insurance hikes. We've got experts joining us today, physicians, policymakers, benefit strategies, those people who are on the front lines of these issues. There's no talking points today. There's no fluff. It's just real numbers and real answers. If you're in the business of healthcare, you're a patient, a physician, a taxpayer, these problems aren't abstract to you. They're hitting your bottom line right now. I'm Dutch Rojas. Let's get into it. Every year, we throw more money at healthcare, and every year it gets worse. Prices go up, access goes down, and the people in charge pretend they're fixing it. Health systems are still hiding prices. Medicaid spending is skyrocketing, and now state employees, the very people keeping the government running, are about to get hammered with almost triple-digit hikes. But don't worry, the same people who created this mess have a plan. They always do. Let's be clear, this isn't an accident. The system is designed to confuse, overcharge, block competition. Health systems don't want you to know what anything costs. Government spending keeps ballooning without any accountability. Welcome, Doge. And when the budgets run dry, they pass the bill to the taxpayers and workers instead of fixing the problems. Now, we're going to break all of this down today. We're bringing in experts who actually know what they're talking about, other than me. Not bureaucrats or healthcare system executives who try to spin a narrative. We're going to cut through the nonsense, expose the real numbers, and lay out what's next. First up, price transparency. Why do health systems keep fighting it? Let's start with something that should have been obvious decades ago. President Trump signed an executive order yesterday requiring health systems and insurers to disclose actual prices. And guess who's upset? And who's mad? And who's furious? And who's whatever? Progressive senators and health systems. Why? Because their entire business model depends on grifting and keeping prices hidden. Health systems claim price transparency confuses patients. What they really mean is that they don't want you to see the scam. The 2019 rule forcing health systems to post prices has been largely ignored. Many choose to pay the small fines instead. The new order strengthens enforcement, but will it actually be enforced? Or will health systems find another loophole? Lucien, congratulations on your Fast 50 award.
Oh, thank you.
Yeah, that was a pretty big deal.
Yeah, it's been exciting to see how the market's responded to what we're doing at Savvos. So thank you. I appreciate that.
Tell me, why is, a couple things. One, why is price transparency essential for patients, but also really what you're working on, employers? Give us an idea.
Well, I think what we're trying to do from a legislative standpoint, long term, can have a real impact, right? I mean, I look at what, this recent executive order, what we're trying to do in terms of enforcement of legislation that was actually implemented like 4 years ago. So it's kind of been a slow rollout, but if you look at what's happening in the healthcare space today, and you look at the shifting landscape between the way that health plans and patients are working with providers, I mean, they're wanting a different type of a business transaction. And what we stumble with today is this opaque kind of claims processing marketplace, which makes it really difficult for consumers to make, useful pricing decision. And I would go beyond that, not even just consumers, but some of our major health plans in the markets today are having a hard time nailing down pricing without better, transparency and the ability to access data a little faster. So I think what we'll see is, long-term, a lot of impact from this push to enforce what we started about 4 years ago.
What kind of solutions is Savvos offering?
Well, if you think about it, right, like we're talking about direct cash pay in a third-party payer environment, right? So Savvos, as a digital healthcare company, we create a completely different payment rail, which is really trying to facilitate what we're doing legislatively with things like these recent executive orders and really pushing for price transparency, just trying to get stakeholders like patients and employees and health plans and employers the ability to connect with useful affordable pricing when they're making, healthcare decisions, right? Because like when you think about the potential of price transparency, you look at your average family or you look at health plans in general, but you look at any of these populations, and the reality is that the vast majority of the healthcare that we consume, these are anticipated scheduled medical procedures. I mean, when you look at most utilization reports, it can be as high as 80 to 90% of the dollars we consume in healthcare. These are planned scheduled procedures. So in an environment like that, where we're talking about orthopedic surgeries or we're talking about inpatient hospital procedures. I mean, if the vast majority is something we're planning for, then price transparency can have a dramatic impact on the market if we implement effectively, and really drive decision making, not just across individual consumers and patients, but I think across third-party payers and health plans as well.
Yeah. Listen, you're doing great work. We can't wait for more people to call you. Get involved with Savvos.
Yeah, hey, I really appreciate that because I think, the combination of what we're doing legislatively as well as engaging consumers, really starting to get engaged with bringing about change in healthcare. I'm a big believer that real legislation good legislation can bring about some really exciting change if it's coupled with consumer sentiment and market changes. And so we're seeing a lot of that. And really our goal at Savvos is to be at the forefront of transforming the healthcare transaction by replacing opaque, difficult claims network processing with direct, simple cash pay transactions. And it's amazing the impact that it's having already.
Well, here at the Rojas Report, we love the work you're doing. Thank you, Lucien.
Thanks, my friend. Good to see you.
Now let's talk about one of my favorite news subjects, Washington fear-mongering. You usually see it from senators. They should be ashamed of themselves. All right, but this time it's about Medicaid. The headlines the last few days scream that Congress just slashed Medicaid by $800 billion. But here's the truth. Medicaid spending isn't going down. It's just not increasing as fast as it was projected to. Since 2015, Medicaid spending has grown every single year, averaging a 6% annual growth. The COVID spike was even bigger with a 20 or 19.9% increase in just 1 year. The new bill reduces the growth rate by just 0.2% of the year. But somehow, politicians are calling this a massive cut. This is the exact same argument they used to defend the ACA's control measures. Back then, reducing spending growth wasn't a cut, but now it magically is. This show exists because more than 20,000 physicians demanded a voice. They help me, they talk to me, they spend time with me. So listen to me. Follow on, join the fight, and if you like this episode, share it. If you hated it, share it anyway. Don't forget to follow me on social media for more. That's it for the Rojas Report. Rojas out.